if they have dry mouths, they have high blood pressure. Those are things at risk for more frequent dental problems. So actually they should be seen more often than twice a year. But if we can catch things small, first of all, they're cheaper to fix, they're easier to fix. So we like to do things in that stage.
We were talking before we started the show today that gum disease, you know, you don't even know that you have gum disease until it can be quite advanced, and then you're in a real heap of trouble, right?
It's very hard to grow bone back, and so it's easier to prevent bone loss, and that's what gum disease is. It doesn't cause any pain. It's like high blood pressure or diabetes. You don't even know you have it until it's too late. People are often confused or upset, and they say, all of a sudden my teeth are starting to get loose, or I have a foul odor in my mouth, or I'm bleeding. You know, it's not natural when you brush your hair to bleed, so it's not natural when you brush your teeth for your gums to bleed either.
Right. And how important is flossing? Because I know a lot of people don't floss, and they're supposed to.
Right, everyone needs to floss. A toothbrush cannot get in between the teeth. A mouth rinse cannot get in between the teeth. One, it prevents cavities in between the teeth, which is common in adults, and also it prevents that bacteria that sits on the gums and the bones and eats it away. So if you're not flossing, you're missing 50% of your teeth.
Now, you were saying earlier that the average age of your patient is 50 years of age, so you really focus on the baby boomer generation, which I think is very cool.
Well, I enjoy them, and we enjoy helping them out. A lot of them have put things off because they were moms or dads and they were taking care of their families and doing whatever, and now the kids are gone and they want to do it. So like our average age of our Invisalign, those invisible braces, is a 50-year-old, and I enjoy working with them because they take it very seriously and they really appreciate what we can do for them.
I know my mom is getting ready to have some dental work done, and she's in her 70s, so it's never too late, right?
It's never too late. My oldest patient we've ever done a procedure on is in their 90s.
Really?
Yes, so.
Wow, that's very cool.
Never too late.
And what was the procedure that you did?
We actually put a crown on that person. It was a cosmetic crown.
Great. Are there any patient stories that you want to share with us just before we go to break about how someone came in and maybe have been, you know, they were afraid to see you and you took them from, you know, it's okay, we can help you, to, you know, the end result? Well,
there's a lot of stories, and the common thing is, again, that guilt. I'm here, don't chew me out, and we're not going to lecture you, we're here to help you, and they all have these fears that they're going to be hurt, and we get done and said, that's it, yeah, because we take care of them, and then when they give them the mirror and their eyes start to water up and they're tearing up, it makes my day.
I bet, that's great. All right, I got to take a break, so stay with us as my conversation with Dr. Ginger Bratzel continues right after this.